Greetings, dear learners. Today we will learn about the warfare gases. Chemical warfare utilizes toxic chemical substances as weapons, distinct from the nuclear and the biological warfare. Collectively termed as NBC, N for the nuclear warfare, B for the biological warfare, and C for the chemical warfare. Chemical weapons' destructive effects stem from toxicity rather than explosive forces. While the living organisms use concealed biological warfare, non-living toxins like botulinum and the ricin are considered chemical warfare under the Chemical Weapon Convention. The Chemical Weapon Convention categorizes the toxic chemicals into the three groups based on the purpose and the treatment. Schedule 1 is those with a few legitimate uses. Schedule 2 is those with a limited small scale uses, and Schedule 3 is those chemicals with widespread industrial uses. Chemical warfare originated in World War I, causing significant casualties. Mustard gas, a potent alkylating agent, exemplifies the chemical warfare's destructive potential. World War II saw the advancement in the delivery methods, including nerve agents developed by the Germany and the VX by the Englands. Despite efforts to curb the chemical weapons, nations like USA and the Russia and the other continue research and the stockpiling of the chemical weapons. The Chemical Weapon Conventions, that is CWC, aims to eliminate those stockpiled with a mixed progress among the different nations. India is said to have destructed all the chemical weapons that had been there with the India, and India is the leading nation in the elimination of the stockpile of these chemical weapons. Right control agents, tear gases, lachrymators, they provoke the respiratory and the dermal reactions, with a paper spray emerging as the less toxic alternatives to the chemical weapons. So the knowledge of chemical warfare agents are important under the toxicology, as they produce mass casualties because of its effect. In a very short span of time, it may affect a very large population, and its toxic effects may be seen on the large masses. Chemical warfare gases are categorized into the two types, war gases and the right control gases. War gases are used to incapacitate or kill enemies in the times of war. They can be of any form, gaseous or liquid or solid, but the gaseous form is the most commonly used, and even if they are in the solid or liquid state, they get converted to the gaseous state, then only they act on the humans. Then the right control agents are the gases used by the law enforcement agencies, usually during raids to preventive. The main aim of the right controlling agent is not to kill a person, but to disperse the mob by causing certain small or the lesser symptoms that is irritating to the peoples, and that they disperse because of the effect under that. So relatively less toxic agents are preferred as the right control agents. So these chemical warfare gases has a common category. They are all the chemicals that may be used for either as a war gases or a right control gases, depending upon their effect on the body. So both of them don't have any separate kinetics or separate pharmacology. Both the chemicals, those who are have the lesser severity, will be used as a right control agent, and those with the higher severity will be used as a war gases. So there is no separation line between the war gases and the right control gases. Then these chemical warfare agents may be further classified. There could be the environmental classification for it according to its persistence. If the chemicals, they are non-persistent, they are the good right controlling agent, but the bad warfare agent. Persistence mean that once they are thrown into the environment or released into the environment, they persist for a longer period of time. If they don't persist for a longer period of time, they immediately degrades or the evaporates. In those cases, they are non-persistent. So non-persistent are more commonly used as a right control agent because their intention is not to harm much, whereas the persistents are those which will remain in the environment over a longer period of time, weeks or months they may be there in the environment. So they will be producing more of the poisonous effect on the humans. They can be the mustard gas or the levichite. So they are the good persistent agent, and they will be used better as a warfare agent than as a right control agent. So this is the environmental classification according to their nature of the persistence and non-persistence. Then another classification is the medical classification. According to their physiological action, they can be classified as the Walson. You may remember the mnemonic Walson. Walson V for vesicants or the blistering agent. As the name suggests, they will produce the blisters on the body, or the vesicles formation on the body will be their mechanism. Then the asphyxiants or the lung irritant, they will produce the lung irritation and the sign and symptoms of the asphyxia. Then the lachrymators or the tear gases, they will produce the tears, so they are called as the lachrymators. Then the sternutators or the nasal irritants, they will cause the nasal irritation or the increase the nasal secretion. These are called as sternutators. Then the hemolytic, that is they cause hemolysis. Then there can be the certain miscellaneous groups who are not coming in either of the groups. They may be considered as O others. So this is for the sake of mnemonics only. Otherwise, it would have been in the last. So Walsons, you can remember. And for the nerve gases, they cause the paralysis. It acts on the nervous system. We will be learning these all one by one. So starting with the vesicants or the blister gas, they produce the blister on the body. So vesicants are also referred as blistering agent. They are the potent alkylating compounds that induce painful burns, blister, necessitating immediate medical attention even at the low exposure levels. Primary agents used as a blister are the sulfur mustard, commonly known as mustard gas, nitrogen mustard, levishite, and the phosgene oxime. Notably, mustard gas and levishite poses the substantial risks emitting vapors for the extended periods. As we already talked, they are under the category of the persistent gases. Sulfur mustard, a potent vesicant, also possesses the mutagenic and the carcinogenic properties. Victims may not exhibit immediate symptoms but may later experience the skin irritation, itching, and the blistering within 24 hours. Eye symptoms include conjunctivitis and the temporary blindness, while the lung effect involves the bleeding, blistering, and the pulmonary edema. Preventive measures for the vesicant gases are the use of the respirators. They may provide the protection against the vesicants. However, these respirators don't protect the other part of the body. And for the treatment of these vesicant or the blister gases, the immediate step shall be the decontamination. Quickly remove clothing and the visible agents from the skin using dry powders, solvering, and resin decontaminants. Bleaching powder effectively neutralizes mustard gas and the levishite. Then relocate the patient to an area devoid of the vapor hazards and irrigate eyes with the water. Antidote for the vesicant poisons are the N-acetylcysteine that helps to alleviate the inflammatory response in the mustard exposure, while povidone iodine ointment acts as a protective barrier against the vesication. British anti-levishite binds to the arsenic group of the levishite, mitigating its effect. The British anti-levishite was developed against the mustard gas only, and later on it was identified to be useful as a metal chelator. From there, the journey of the British anti-levishite started. Then another chemical warfare agent is the lung irritants, also called the asphyxiant. They causes the symptoms by the lung irritation. Examples are the chlorine, that is the least toxic among them. Chlorpicrin, phosgene, diphosgene are the other lung irritants. Chlorpicrin is 4 times more toxic than the chlorine. Phosgene is the most toxic among them, and about it is 10 times more toxic than the chlorine. Phosgene and diphosgene are also called as the green cross. These agents can be delivered by the gas cells or the tanks. You may have seen that they are being transferred through the cells bomb. They may be thrown in form of the cell bombs. Chlorpicrin and diphosgenes are the liquid forms. They primarily act on the lung alveoli, that is their name, the lung irritant or the asphyxiants. The clinical features presented in the patients include the headache, restlessness, vomiting, coughing, cyanosis, dyspnea, stertorous breathing, chest tightness, watering in the eye, and the death may occur within 20 to 48 hours due to the acute pulmonary edema. So, the acute pulmonary edema in these patients are fatal to death. So, the management shall be concentrated on the management of the pulmonary edema. So, if the exposure is on the eyes, then the boric acid irrigation shall be given along with the water, and then administer the oxygen use medication to suppress the coughings, employ antibiotics if necessary, and consider adrenaline to measure the anaphylactic or other sort of life-saving measures. Then the next group is the lachrymators or the tear gases. They are the non-lethal chemical compounds that stimulate the corneal nerves in the eyes that cause tearing, pain, and even the blindness. Commonly used lachrymator agents are the acrolein to benzyl bromide, bromacetone, bromobenzyl cyanide. Bromobenzyl cyanide is in form of liquid and it is persistent. Then chloracetophenol, that is solid and the non-persistent form. Ethyl iodoacetate, liquid and persistent. Ethyl iodoacetate were used by the Germany. Ethyl iodoacetate were used by the Germany commandos. Then the monobromomethyl and ethyl ketone and xylyl bromide are other primarily used lachrymators. These are the list of the tear gases or the lachrymators that are used for the war purposes, and the list of the lachrymators that are used for the riot control purposes. The lachrymators are the most commonly used for control of the riots. You may find throwing the police personnel, these riot control agents, on the masses or public, which is in the form of the crowd, to disperse them, and the people on the exposure start having the irritation on the eyes, tearing, and extreme burning sensation on the skin as well as the eye. All these features are seen in the patients. So riot control agents use the CN. Its name is not because of this CN is not the chemical name but the origin of the country name. This CN contains the phenacyl chloride. CR contains the dibenzoxazepine. CS contains the orthochlorobenzylamine and the melononitrile, 2-chlorobenzylamine melononitrile. That is the actual tear gas that is recently been used. You can see on this bottle the CS is written. So this contains this melononitrile. And OC, that is ornoracine capsicum, that is pepper spray or the capsicum spray. Then bromacetone, then phenacyl bromide, xylyl bromide, synpropan ethyl azoxide, that is found in the onions. That is why when you cut the onions, you will start to tear it out, because they contain this chemical, that is synpropanethyl azoxide, that has property to cause irritation on the eyes, leading to the tearing. The phenacyl chloride is supplied in a small pressurized aerosol cans to paramilitary and the police forces, known as the tear gas or the mace. Mace is the brand name of this CS. Symptoms on the use of this tear gas include the disorientation, syncope, allergic dermatitis, corneal epithelial damages, chemosis, and rarely death due to the pulmonary injury may also happen on the severe toxicity of these tear gases. This CS orthochlorobenzylamine melonitrile was developed as a riot control agent in 1950s and early 1960s. It is the most popular due to its effectiveness and low toxicity. Symptoms are similar to the other lachrymators, with rare occurrence of the miscarriages and the genetic changes. Here important to note is that with their metabolism, cyanide is also produced. So cyanide toxicity might also happen due to these tear gases. And as we already talked, the symptoms produced due to the tear gases, they cause irritation of all the mucous membrane, oral, nasal, conjunctival, and the tracheobronchial tree. They cause irritation to all the mucous membrane, oral, nasal, conjunctival, and the tracheobronchial. The burning sensation is felt wherever it is exposed. Immediate, forceful, uncontrollable eye setting is there because of the eye irritation. Then the tear is profuse, tear is there, coughing might be there, running nose with a mucus, burning sensation in the nose and the throat region. Prolonged exposure leads to the blistering of the skin, conjunctivitis, corneal ulceration, keratitis, and the pneumonitis. In rare cases, they may cause acute laryngotracheobronchitis and even death in the person. So these are the features that are produced with respect to the tear gases. To manage the patients who have been exposed to the tear gases, the immediate step is to take away the patient from the site of the exposure to the fresh air. Then eye care should be done by irrigating the eyes or wash the eye with a normal saline or boric acid solution. Skin, nose, and other sites should be applied with a weak solution of sodium bicarbonate. Washing with the sodium bisulfite in the concentration of 5% is helpful at the site of exposure. So usually it causes effects externally. So external application and the decontamination of the body is enough to recover the patient. In case where there is the severity or the laryngobronchitis, in those cases, appropriate management shall be taken, steroids or oxygen therapy shall be given. All these may be helpful from the management of the lachrymators. Then the next chemical warfare agent in the Walson, that is Sternutators, that is nasal irritants or the vomiting gases. They are derived from the Latin word sterno, meaning sneeze, or the nasopharyngeal irritants are the non-lethal agent inducing extreme irritation to the nose and the throat. They cause intense pain, irritation affecting nose, sinuses, throat and the eyes. They cause a sneezing in the person, nausea, vomiting. So they are named as vomiting gases. They also produce the severe headache, salivation, tightness in chest and the prostration. Their effectiveness depends upon the condition of the person or the patient. Sternutators are ineffective when the mask is used. Inhaling them before applying the mask makes wearing the mask highly uncomfortable. So, if a person has been already exposed to the Sternutators, if someone applies the mask later on, then in that case he will be already irritated and he will try to throw out the mask, and then in that case he will be further exposed to the Sternutators. In those cases, the primary treatment is to take away from the site of the exposure. Various Sternutators that are used are the black and the red pepper, organoarsenicals, that may be the diphenyl chloroarsine, diphenylamine chloroarsine, also known as Adamsite or DMI, diphenyl cyanoarsine, DC. Diphenyl chloroarsine is 6 times more heavier than air. Then phenyl dichloroarsine. These all are used as the sternutators. Then the basic mechanism of action involved with the sternutators are that the diphenyl chloroarsine stimulates the vomiting center. It causes intense pain and irritation in the nose and the sinuses, leading to sneezing, malaise, headaches, salivation, followed by the nausea and vomiting and the chest pain. As the name suggests, arsine gases, so they have symptoms similar to the arsenic poisoning. So the name arsine has been given to these chemicals. For the treatment from the sternutators, remove the patient from the contaminated area, remove the clothes worn, and the solution of sodium bicarbonate for the irrigation of the eyes in the concentration of 2% for the eyes and the 5% for the nose is very helpful in the control of irritation due to the sternutators. In this way, we may manage the patient. Then another chemical warfare agent is the nerve gases, also known as paralyzants. They are basically the class of organophosphorus compounds. They have been classified as the weapons of mass destruction by the United Nations in the April 1991. Their production and stockpiling is outlawed by the Chemical Weapon Convention of 1993. They are of different generation. First generation of the nerve agents include the Vesicants and the Asphyxiants. We already saw them. Then the second generation is the G series. G is here the country's name, where it was produced. G is for the Germany. So it was started with the Germany. So it is the Germans G series that includes the Taboon, that is GA, developed in the 1936. Then the Serine, that is GB, and then the Suman, that is GD, and ethylsaline, that is GE. So these are all the second generation of the nerve agents. The cycloserine is the GF, that is the non-persistent form of the nerve gases. Then the third generation nerve gases are known as the V series. V for the venomous or the viscous, because they are very toxic and they are in the persistent nature. So they are classified under the third generation of the nerve agents. They are the VE, VG, VM, VR and VX. Then the fourth generation of the nerve agent, that is very toxic, and that lacks any treatment agents. They are the Novichok agents, because Novichok is a Russian word that means the newcomer. They are the newcomer agents. They were developed by the Soviet Union from the mid 1960 to 1990 against the NATO organization. They were basically developed with the aim that they will not be detected or neutralized by the NATO agency, and they can be hidden anywhere, and they are not their protocol of their identification. So their chemical structure was changed and the new agents were developed. They include the Novichok 5, Novichok 7, Novichok fractures and others. In this way, the different generations of the nerve agents had been developed, and they act on a similar way like the organophosphorus compounds. You already read about the organophosphorus compounds in detail. So the way the organophosphorus symptoms are produced on the body, the way similarly symptoms are produced with the nerve agent. They act very fast, they act on the NN receptors, they cause immediate paralysis in the patient, and the military or the where in the case of the war, the enemy army is exposed to these nerve agents, then immediately they will be paralyzed and they will have the not able to fight the war, and in this way the countries involved may win the war by use of these nerve agents. These nerve agents are basically the compounds of the phosphate esters in action and toxicity. They are colorless, odorless, and the volatile liquids. They are absorbed through the lungs, gastrointestinal tract, the skin, and the conjunctiva. The mechanism of action of the nerve agent, as we already talked, they are similar to the organophosphorus compounds. That is, they inhibit the cholinesterase at the cholinergic synapses. That results in the consequent accumulation of the acetylcholine that causes the muscle twitching, glandular hypersecretion, and the cognitive and the mood effects. High doses causes seizures and the death from the respiratory failures. Nerve agent affect both the types of the cholinergic receptor, that is muscarinic and the nicotinic receptors. In this way, they have all that sorts of the symptoms, including muscarinic symptoms and the nicotinic symptoms. As they are not localized to any body parts, as they can be absorbed through the skin also. So for the protection from them, whole body cover is required. So just the respirator will not help in the protection from the nerve gases. The person to he will need the whole body cover for the protection from this nerve gases. The clinical features are similar to the organophosphate compounds, that is the pinpoint pupil, rhinorrhea, bronchial spasm, ciliary spasm, pain in the eyeball leading to photophobia, sudden unconsciousness, bradycardia, respiratory arrest, and it may finally lead to the death of the person. So all the secretions are increased, salivation, lacrimation, gastrointestinal, and the features that we already saw in the organophosphate poisoning, all features will be seen in the patients of the nerve gas poison. Then for the treatment, similar to the treatment of the organophosphate compounds, the treatment of choice is the oximes and the atropine. Atropine does the anticholinergic effect, as nerve gases are cholinergic poison, so anticholinergics. So atropine, anticholinergic, directly antagonizes the effects of the organophosphates. Oxime, the mechanism of action you already understood in the organophosphate compound. Oxime is given to detach the agent from the cholesterases, thus reactivating the enzyme. It mitigates both the nicotinic and muscarinic effects of the nerve gases for those nerve gases against whom the oximes are effective. Muscarinic antagonist, that is atropine, is used to quell the effects of excessive acetylcholine action. Atropine is of a special value when the nerve agent is oxime resistant, like in the case of the Schumann, they are the carbamates, or when the symptoms are severe. So you already understood about the different sorts of mechanism and the management aspect in cases of the organophosphates and the carbamates. And finally the O, that is the others, that includes the miscellaneous groups. So these miscellaneous agents are also used under the chemical warfare agents. The agents that act on the blood are the arsine, cyanogen, cyanogen bromide, cyanogen chloride, hydrogen cyanide, phosgene, vinyl arsine. And the agents that produce the psychiatric symptoms are the psychoagents. They include the BJ3-quinoclindinyl benzylate, KLSD, and SN-serenile, that is PCP. So all these agents are used as a chemical warfare agent. This is again a very developing science, and it's keep on updating about the different warfare agents and what all can be used as a warfare agent. This is all we should know for the warfare agents. Thank you.